Good afternoon, everyone. My name is David Pokhrel. I'm the project manager, and today our presentation will take place regarding risk, quality, and project evaluation for our ongoing multi-EHR implementation. So, let's move on to our presentation. As we all know, EHR offers many benefits compared to our paper records, but on the same time, there are several barriers to their adaptation and implementation, including issues of finance and technical concerns. Some of the project risks that we are going through are technical in terms of CDSS and online patient portal launch difficulties. Cost and financial budgets for overall project, privacy and security of data, contractual terms and deadlines between vendors in terms of infrastructures, usability of program among several hardwares and appropriate training for the workforce, system migration where the vital existing data is to be migrated, allocating the updates without harming or losing the information. Interoperability with transfer of allocated data is vital. Lawsuit and legal complications arise with the EHR implementation where policies may need to be revised. With involved risks, we have timeline, the risk level along with the mitigation plan. As part of technical difficulties that we are facing in launching the CDSS and online patient portal, technical team with the help of super user will be making necessary problem resolutions within 2 months of time frame. Depending on the timeline of the overall project cost, finance will be evaluated during the first 2 months of the project. Implementation team members will be revising the Data Privacy and Security Act within the system and will be making necessary changes updates within allocated 2 months of time frame. Contractual deadlines and criteria will be revised with appropriate follow-up with vendors and clients. Training along with call center services will be provided to all workforce involved in the project during 3 months time frame. With collaboration with IT lead, system migration, interoperability tasks will be performed with necessary updates in order to make the system compatible with existing data during 2 months of time frame. The challenges of managing quality is substantial. Thus, we can see EHR clinical and financial quality measures are divided into two forms. On the clinical part, we can see electronic prescription, patient registration, where the platforms are obtained with either apps or websites, clinical decision support, secure messaging communication channel, radiology information system, where the pictures can be arrived and can be communicated more efficiently, computerized physician auto entry, and document manager. On the financial side, we can see improvement for the functionality and ease of use within the users. Similarly, clinical documentation that will be for billing and coding, for reporting, and for public health reporting. Let's discuss about some of the EHR's capability. As we are all aware, EHR brings rapid changes within the organization, helping order entry of data management, storage and retrieval of health information, decision support management, electronic communication and connectivity, adequate patient portal support, administration tasks, and also helps in generating reports for public health. For successful implementation of multi-EHR, project strategic plan is vital. This will help us to minimize the risk factors in the terms of technical, financial, and operations during the implementation. Successful review of goal and objectives to all workforce. Review goals and objectives. Review, test, validate, and gain approval of specification for CDS. Work plan and monitoring system development. Formation of implementation team members. Conducting situational analysis. Data security plan. Software customization and usability. Training and awareness. Campaigns with all the people that are involved in the project. Cost analysis of each components. Consideration of different incentives program. Project evaluation along with planning is necessary during the implementation of EHR. During the implementation phase of EHR, it will take place in accordance with the time frame. As we can see, during 9 to 12 months before going live, we'll be ensuring staffs that are on board with EHR implementation, consult SCSS and PCA for EHR selection and implementation resources. Also, we'll be scheduling vendors, trainers, and implementation support during 6 to 9 months before going live. We'll be developing EHR selection, implementation leadership team and their roles. We'll be mapping EHR workforce, and also will be engaging staff to optimize workflow for patients. During 3 to 6 months before the go live date, we'll be evaluating all the clinical readiness, we'll be scheduling staff training, we'll be confirming timeline with vendors, we'll be informing and preparing patients as per necessary EHR migration. During 1 to 4 months before the go live date, we'll be confirming everyone if they have been trained properly, and we'll be conducting refresher trainings or check-ins for the persons that are lagging behind. Also, we'll be building common internal workflow and terms. Also, there will be continued constant messaging and communication during this implementation time frame. During our 1 to 3 months of time frame before go live, we'll be building patient records, we'll be communicating with staff about the implementation timing, approach, and expectation that we look forward for the EHR implementation. Also, we'll be adjusting patient schedule to account for implementation. Before 1 month of go live, we'll have proper access and we'll be rechecking the skills, workflow, utilization, and all the other keys to long-term success. We'll also be gathering feedbacks and we'll be addressing it accordingly. In order to tally the effect of EHR implementation on practice, productivity, and reimbursement within the network, long-term analysis is very important. Thus, here we can see a long-term evaluation. We have concluded cost benefit, ease of use, and cost effectiveness. Cost benefit analysis is widely used and helps in proper cost benefit evaluation that generate yearly revenue within the organization, and also cost effectiveness evaluation is to include PI incentives received for the initial capital cost and compare those to the cost of the rate and the value that is going with along with the reimbursement. Similarly, ease of use applies to the administrative department as much as it does to the physician. Hence, it is important that the support staff is able to use it more efficiently, providing the patients a better experience. Thank you so much for your time, guys. And if you have any questions, do let me know.